Yes, please. Right, so if you have read and understood, considering age communication skills station, kindly begin.
Hello, I'm Dr. Karma, one of the SHOs working for Mr. Tom in downtown hospital. I'm calling to speak to Mr. Alex, the hepatobiliary consultant, to ask him about the patient, to ask him an advice about the
Karma,
patient.
there's too much noise behind you.
There's no noise.
No,
Okay,
it's better. No, it's better.
better, ma'am?
Yes, please. Continue.
Okay. Hello, I'm Dr. Karma, one of the SHOs working for Mr. Tom in downtown hospital. I'm calling to speak to Mr. Alex, the hepatobiliary consultant, to ask him advice about the patient. Can I check that I'm talking to Mr. Alex?
Yes, you are. Can you summarize your case?
Thank you.
Yes, I have a 44 years old obese female who underwent laparoscopic cholecystectomy, and today it's her fourth post-operative day. She has been complaining of abdominal pain, nausea, and on examination found that she is tachycardic, pyrexic, and slightly jaundiced. And we also noticed bile in her abdominal drain. She has generalized abdominal pain, but the abdomen is soft. The blood workup that was done 2 days back showed that she has raised total leukocyte count, raised bilirubin, and also elevated CRP. And we have arranged an abdominal ultrasound which showed that there is free fluid in the abdomen, but no CVD dilatation. And I think this patient has a bile leak, and we are hoping to transfer this patient under your specialist care for definitive treatment.
Okay. What are the sources of the leak? What do you think could be the source of the leak?
I think it may be due to the cystic duct stump leakage due to the slippage of the clips or retained CBD stone. It could be because of CBD injury or accessory cystic duct or from leakage from the liver beds.
Okay. So what are the what have you done for her right now? What have you done anything for her?
Yes, I have resuscitated her with IV fluids and also antibiotics. Then I will send her blood workups again, and I think she will need an ERCP to find the source of the leakage and probably put a stent if required. But that is not available in our hospital right now.
Okay. Why do you think our CRP is up?
Yes, she's having acute. It's an acute condition. She's having acute inflammatory condition. That's why the C-reactive protein is raised.
Okay. What does ERCP? What does it stand for? You mentioned ERCP the other time. What does it stand for? And how is it done?
ERCP, it's a endoscopic retrograde cholangiopancreatography. And here we put endoscope until the second part of duodenum, and we inject a dye, and we see the status of the CBD and the biliary tree, and thereby helping us to identify and delineate the source of leakage. And also it can it has the advantage of through this we can remove any residual stones in the CBD, and also if needed we can put a stent.
Okay. Is this urgent?
Yes, sir. We fear that she might developing biliary peritonitis.
Okay. So what arrangements have you done now if there's no space to receive her? There are no beds available at the hospital at the moment.
So I will talk with the bed manager and of both the hospitals and discuss the possibility of creating beds for this patient, and also discuss whether there is whether we can facilitate discharging or repartitioning of the patients.
Okay, so peradventure there is a leak, as you said. So how is this managed?
Yes.
How do you manage a...
Initially, we can, if it is because of the leak, then we can manage with the stenting, and also keeping the drain in situ initially, and then if it is surgically possible, then the patient might need definitive surgery.
And what will that be? The definitive surgery? Any idea?
We can try particular jejunostomy or polyduco. I think.
Okay.
Can't remember.
Okay. I think you can send the patient over. It's okay.
Okay, sir. Thank you.
Well,
Sir.
so I think so. Your summary. What have we discussed so far?
Yes. I called you to discuss about the patient, 44 years old female who is on a fourth POD, who is complaining of abdominal pain, and possibly it could be because of bile leak, because since she has raised leukocyte count, jaundiced, and raised CRP, and ultrasound showed intra-abdominal free fluid, and there's a bile in her abdominal drain. So possibly there might be bile leak. So I'm referring. I want to refer this patient under your specialist care for definitive treatment. And I've started her on IV fluid and antibiotics.
Okay, all right. Well done, Doc.
Thank you, sir.
Okay. Well done.
What more you could have asked? There are still certain questions. Did you ask about the drain? Is the drain in there?
Okay, I mean, and the blood investigations.
Yes.
How old are they? That's what I also missed.
Yes.
Yes.
So those are the questions. I don't know. The station looks a bit short. I don't know.
It's short, but then there are more things you had to discuss. Where do you think, if you have any evidence from where do you think bile is leaking? So source to discuss was one thing. And then, okay, I'll ask you first, if you can give the feedback to Dr. Karma. In your opinion, how well?
Yes, he actually answered most of the questions, and I think just that he mentioned the ERCP. I think before I asked what he was going to do, so I don't know if that's accepted.
Yes, even the description he told about ERCP, he could have improved. He'll go back and he'll listen again. He didn't say that it was an X-ray type of examination. and it's a flexible telescope that you insert, and then from where you have to insert the dye and at what time, and what purpose ERCP serves. It's diagnostic as well as therapeutic both. So if he would have explained this elaboratedly a little bit more, and then how is this managed? So first he would talk about stabilizing the patient, and then fluid, and then antibiotic, and then yes, all these managements. If there are no beds available, what he would do, he will keep the patient in the hospital at that moment. And then what he told you about CRP, he said it's an acute phase, but CRP is an acute phase protein. So it signifies that there is an acute infection. His definition was not like this.
Yes, it can also be raised due to the operation anyway. So it's
yeah.
It's
so it's not significant of acute bile leak in particular.
Yes.
Yes.
Right. Yeah,
thank you.
That's it. Thank you, both of you. Thank you, Dr.
Thank you, ma'am.
Thank you.
Thank you for the